Hello, everyone, and welcome back to Beauty Intelligence. Today, we're diving into a topic that many of us have dealt with at some point in our lives: acne scars. Those stubborn reminders of past breakouts can be a real challenge to tackle, but fear not, because we've got you covered with some valuable insights and tips that are backed by academic research. Acne scarring is a common concern for those who have experienced acne. It can have significant psychosocial consequences and can negatively impact the quality of life. Acne scars are the result of our skin's natural healing process after a bout of acne as a result of the inflammatory response to acne lesions. The pathogenesis of acne scarring is not fully understood. However, factors such as cytokines, chemokines, enzymatic damage of collagen fibers, and genetic control may play a role. Acne scars can vary in appearance from tiny marks to deeper indentations, and they often leave us feeling self-conscious about our complexion. Today, we will explore different types of acne scars you might encounter, understand what causes them, and most importantly, discover various techniques to improve their appearance, whether you're dealing with those dreaded ice pick scars or the more subtle rolling scars. But hey, before we dive into the remedies, it's essential to remember that each individual's skin is unique. What works for one person might not work for another, so it's essential to be patient and find the right approach that suits your skin type. So if you're ready to explore and combat those pesky acne scars and hello to clearer, smoother skin, hit that subscribe button and stick around. We've got some fantastic tips and tricks coming your way. Remember, you're not alone in this journey. Let's embark on this path together toward healthier, happier skin. Acne scars are permanent marks or indentations on the skin that result from severe acne lesions. When the skin experiences a significant inflammatory response to acne breakouts, it can lead to the destruction of collagen fibers in the affected area. Collagen is a protein responsible for maintaining the skin's structure and elasticity. When it is damaged, the skin's natural healing process may not fully restore its original texture, resulting in the formation of scars. There are several types of acne scars, each with its distinct characteristics. 1. Ice pick scars. These scars are deep and narrow, resembling small puncture marks on the skin. They are called ice pick scars due to their appearance, similar to that of an ice pick piercing the skin. 2. Boxcar scars. Boxcar scars are wider and have well-defined edges. They often appear as round or oval depressions on the skin, similar to chickenpox scars. 3. Rolling scars. Rolling scars have a wavy or rolling appearance on the skin due to fibrous bands pulling the skin downward, creating an uneven surface. 4. Hypertrophic scars. Unlike the previously mentioned types, hypertrophic scars are raised and thickened. They form when an excess of collagen is produced during the healing process. 5. Keloid scars. Keloid scars are similar to hypertrophic scars, but extend beyond the original boundaries of the acne lesion. They are caused by an overproduction of collagen and can be larger and more raised. Acne scars can have a significant impact on a person's self-esteem and confidence, and addressing them may require various treatment approaches, including professional dermatological procedures and at-home remedies, including various types of resurfacing, chemical peels, lasers, lights, cryotherapy, use of dermal fillers, and surgical methods such as dermabrasion, subcision, or punch excision. Individual scar characteristics, including color, texture, and morphology, determine the treatment choice. Combining treatment methods may provide additional improvement compared with one method alone. It is important to note that none of the currently available treatments achieve complete resolution of scars. Therefore, prevention of scarring through early and aggressive acne treatment is the best approach to treat acne early enough to minimize the extent and duration of inflammation. Acne breakout and scarring are often intertwined in a continuous cycle. It all starts with the clogging of hair follicles and pores with excess oil, dead skin cells, and bacteria. This environment becomes a breeding ground for acne-causing bacteria. As the bacteria multiply, it triggers inflammation in the affected area, leading to those pesky red and swollen pimples we're all too familiar with. If not treated properly, these inflamed lesions can rupture and damage the surrounding skin, exacerbating the risk of scarring. When the skin's natural healing process kicks in, it attempts to repair the damage caused by acne. However, sometimes this process isn't entirely smooth, and an overproduction or underproduction of collagen can result in different types of acne scars. Ice pick scars, boxcar scars, Rolling scars. The types can vary, but they all have one thing in common. They impact our skin's texture and appearance, leading to self-consciousness and frustration. The early and effective treatment of acne is crucial to control acne lesions and minimize inflammation to reduce the risk of scarring. Breaking this cycle requires proactive skincare, timely treatment of breakouts, and gentle handling of the skin. And remember, the earlier you address acne, the less likely it is to leave behind lasting scars. Acne, whether mild or severe, can be frustrating and can affect our self-confidence. As just discussed, not all acne is the same, and its causes can be multifaceted. That's why it's crucial to consult a medical professional, like a dermatologist, to get a proper diagnosis and personalized treatment plan. First off, a dermatologist can determine the type of acne you're dealing with. Is it hormonal, cystic, or simply due to clogged pores? Knowing the root cause is essential in tailoring an effective treatment approach. Over-the-counter products can work for some, but they might not be enough for others. That's where a dermatologist's expertise comes in. They can prescribe stronger medications or topical treatments that target your specific type of acne, accelerating the healing process. But it's not just about treating the acne you have right now. Seeking medical attention can prevent future outbreaks, scarring, and skin damage. Untreated acne can lead to long-term consequences, such as deep scars or dark spots that linger on your skin. Medical professionals can assess your skin and overall health to determine the right medication or type of intervention for your body holistically or prescribe dosage for your needs. Moreover, a dermatologist can help you build a proper skincare routine that suits your skin type and addresses your concerns. They can guide you in selecting the right products and avoiding potential irritants that may worsen your acne. Additionally, acne can sometimes be an indicator of an underlying health issue, especially if it's sudden or severe. A dermatologist can assess your overall health and identify any potential red flags that may require further investigation. Lastly, remember that dealing with acne can take an emotional toll as well. It's essential to have someone you can talk to about your concerns and frustrations. A dermatologist only provides expert advice, but also offers emotional support during your acne journey. In a nutshell, seeking medical attention for acne is vital for a clear and healthy complexion. From accurate diagnosis to personalized treatment plans and emotional support, a dermatologist can be your ally in conquering acne. So, if you've been struggling with acne or simply want to take better care of your skin, don't hesitate to reach out to a dermatologist. Your skin deserves the best, and investing in professional guidance is a step towards a happier, more confident you. Now, there are some methods you can apply at home to help you achieve a clearer skin. Let's jump right in. 1. Exfoliation. One of the key steps in diminishing acne scars is exfoliation. Regular exfoliation helps remove dead skin cells, which can help reduce the appearance of scars. Use a gentle exfoliant with ingredients like alpha-hydroxy acids, AHAs, or beta-hydroxy acids, BHAs. Be cautious not to overdo it, as excessive exfoliation can irritate the skin. 2. Topical treatments. Explore over-the-counter topical treatments that contain ingredients like retinoids, vitamin C, or niacinamide. These can promote collagen production and improve the skin's texture, potentially minimizing acne scars over time. Always do a patch test before applying any new product to ensure your skin tolerates it well. 3. DIY face masks. There are several natural ingredients that may assist in reducing acne scars. For example, mixing honey, aloe vera, and turmeric can create a soothing and beneficial face mask. These ingredients possess anti-inflammatory properties and antioxidants that may aid in healing and rejuvenating the skin. 4. Microneedling. Microneedling, when done properly and safely, can be an effective at-home technique for acne scar improvement. It involves using a derma roller with tiny needles that create controlled micro-injuries in the skin, stimulating collagen production. Always follow the instructions carefully and maintain proper hygiene during the process. 5. Silicone gel sheets. Silicone gel sheets have been found to be helpful in reducing the appearance of scars, including acne scars. These sheets create a protective barrier over the scar, which may help retain moisture and improve its texture. Regular use over several weeks can lead to noticeable improvements. 6. Sun protection. Protecting your skin from the harmful effects of the sun is crucial when addressing acne scars. UV rays can worsen scarring and lead to further skin damage. Use a broad-spectrum sunscreen with at least SPF 30 and wear protective clothing when you're exposed to the sun. 7. Healthy diet. A balanced and nutritious diet plays a significant role in skin health. Incorporate foods rich in vitamins A, C, and E, as well as zinc, which promote skin repair and collagen synthesis. Stay hydrated by drinking plenty of water to maintain skin elasticity. 8. Patience and consistency. Remember, improving acne scars takes time and patience. Be consistent with your chosen treatment methods and allow your skin ample time to heal and regenerate. Avoid the temptation of trying multiple treatments simultaneously, as this may lead to irritation. In conclusion, improving acne scars at home is possible with dedication and a gentle approach. Exfoliate regularly, consider using topical treatments, and explore natural remedies like DIY face masks. Micro-needling and silicone gel sheets are also worth trying, but always follow proper guidelines. Don't forget the importance of sun protection, a healthy diet, and most importantly, being patient with the process. If you're unsure about which methods are suitable for your skin, consult a dermatologist for personalized advice. Thank you for joining me today, and I hope these tips will be helpful in your journey towards clearer and smoother skin. If you found this content valuable, don't forget to like, share, and subscribe to my channel for more beauty content backed by science. Remember, you're not alone in this journey. Until next time, take care and be kind to yourself.